With 50% of the population, women's health is not a niche, but women's health issues are still underdiagnosed. Philips addresses the unique challenges of women's health. Their digital apps can support women from early pregnancy to postpartum, creating positive brand engagement and increased satisfaction. Learn how Philips improves women's health outcomes and find out how insurers can make a meaningful impact on women's lives. Please welcome Philips.
Hi everyone, I'm Raymond Uitenbulte. I lead our insurance solutions over at Philips within the mother and childcare space. With me I've got Emily.
Hi, I'm Emily. I'm the new business lead for Philips Europe.
So today we're going to be talking about something different here at this event. It's not the typical Gen AI type of thing, it's talking about people. We're talking about women's health and how we can improve the value for people that you serve, the women that you serve, but also create a real, tangible, meaningful business impact. So we're going to be focusing on maternal health specifically and how you can support people through pregnancy. But before we do that, we actually want to zoom out and talk about women's health a little bit. Women's health is a vast space. Women's health considers anything from the life stages of early puberty to all the way towards pregnancy, postpartum, and menopause. But at the same time, it also has all of these unique conditions that women experience. So think about PCOS, endometriosis. Endometriosis on its own is a condition that's only diagnosed after about 8 years that people have to suffer through that. But also there are conditions that are way more unique or at least more prevalent towards women. So think about dementia, osteoporosis that are 2 or even 4 times more likely for women. So when we always talk about, and you heard it in the intro as well, when we talk about women's health, we want to remind people, actually this is not niche. It's 50% of the population, but we still consider it very much to be a niche area. But it is not. And we as a health tech company, Philips is a health tech company on its own, we feel that we have a deep responsibility to focus on that 50% of the population, because if we're there to improve outcomes and consumer and patient and customer well-being, then women's health is an area that we should focus on.
Thank you. So what if we don't do anything? What if nobody here takes away anything and does a women's health strategy within their business? So the price of inaction is something that we want to talk about with you. And actually, women are part of families, communities, economies, and that really impacts productivity, the cost of care, and ultimately social care burden as well. So we know that 4 in 5 conditions are actually going currently undiagnosed, and that is something very prevalent at the moment within women's health. We see that 60% of maternal mortality is actually preventable. And we also know that 15% of women experience anxiety during pregnancy, but also postpartum depression affects 15%. And those are the ones that seek clinical advice and support. And there's still a lot of stigmas attached and associated around mental health. So this number is actually likely to be a lot higher. And finally, we know that women spend 25% more of their lives in poor health compared to men. And as I let that sink in, these are just a couple of data points that we're talking about today. Of course, there are thousands that are, affecting women's health that we really need to address. So why do these data points exist? Why are these? What is driving behind these? So actually, we see that some of the reasons that we're facing these challenges are actually because before 1993, women weren't legally included within clinical trials, and that is why historically a lot of the data is focused on men. We also know that of healthcare funding, only 2% of healthcare companies is focused on women's health. And finally, we see that when women go to their doctor, it's 2 times more likely that their healthcare conditions are going to go dismissed. And this rises significantly when talking of women of color as well.
So as an area, you might be thinking, okay, what can we do as an insurer? Where do we start? How can we work with companies to collaborate to make a difference? And also, what's in it for us? And I know that's an important topic when we talk about anything within the insurance space, but there's definitely an upside. The first one that we want to talk about is really consider women as your key target audience. And more specifically, women are actually, the numbers here, 90% the decision makers in healthcare, and with 95% also the decision makers within health insurance. So when you ever think about who are you addressing with health insurance, it's actually the women. They're also responsible for 80% of healthcare spending, and they are far, far more likely to be making use of digital health tools. So they are a target audience that's willing to adopt these tools. They're making the choices in terms of what they spend their money on, and they're making the decisions for themselves, their friends, and their families. We actually also did a study that showed that if you provide the right benefits during, for instance, pregnancy, it actually has a profound impact on the retention of your customers. So this is a study that we did where we showed people who got great benefits during pregnancy from their insurer are about 70% more likely to retain with their insurer for the next year. So this is a pivotal life moment to capture an audience that's willing to create a meaningful relationship with you as a brand.
Thank you. So wouldn't it be great if we could be there from the very beginning? So we know pregnancy is quite a short time within the lifespan, so between 9 to 10 months of being pregnant. And often someone won't inform their insurer they're pregnant until at least 12 weeks, but often a lot later. And at that point, it's very difficult to implement preventative healthcare. So if you can be there from the first few weeks, you really have that unique opportunity to make a difference and start to put preventative steps in place. So we know that understanding the journey needs to be unique. Every pregnancy is different. Even if you have multiple children, you'll know that the situation is very different, even depending by child, and regulations often change and update. This is a moment where people start to rethink a lot about their insurance. They might change the house, they might get car insurance, they might consider life health insurance for the first time, supplementary options, and really supporting a healthy pregnancy. So what shouldn't you be doing, life stages, and that also involves the preparation for parenthood, not just physically, but mentally, emotionally, and having that support really is a really life-changing event and moment. And this also goes with informing and protecting against risk, of course, for newborn and child to come. So we created an amazing solution, Pregnancy Plus. So hopefully some of you have heard of it, but if you haven't, this is the #1 downloaded pregnancy app in the world. We have a fantastic app that talks through every single week of pregnancy. We have a dynamic 3D fetus model that grows as the baby grows and develops, and all the information is given to you every week. So you can see that we have 80% market share in Europe. So that means that 8 out of every 10 mums start their journey through pregnancy and continue it with Pregnancy Plus. And we've been working with some amazing providers and companies. So we've been working with Groupe Mutual for the last year, and they really are pioneers in the women's health space. They have a fantastic women's health accelerator program called Tech for Eva, which has raised more than 180 million in venture capital to date. We also work with public health companies such as the NHS and the White House in the US. So we're going to share with you a quick video, which we have been working with Groupe Mutual for the last few months, just to come to life a little bit about the experience of what that looks like within the app.
Hi, I'm Sophie, a midwife at Tommy's. We're working together with Pregnancy Plus.
My name is Dr. Elizabeth Werner. I'm a clinical psychologist and researcher specializing in perinatal mental health.
Hi, I'm Pearl Vyas, an experienced medical doctor specializing in breastfeeding research, lactation counseling, and part of a global collaboration to promote awareness of infant feeding techniques. Let's dive into it.
And if we break down that journey a little bit more into what would that mean as an insurer if you implemented this? So we can take the Fantastic Group Mutual example. So you can see that actually what we do is we create a branded personal experience for members. So a lot of people, and we know this from a survey, didn't know actually what was included in their basic versus supplementary, what benefits they have provided to them. So we really broke that down with articles within their core content. So just those members will see specific branded content and articles. We've also included the premium subscription, which is really rich content and video courses available on a magnitude of different topics. What we've also done is created access to many different resources, and this helps free up the insurer's customer care as well, because people would be asking for information, but actually now they can find it all in one place within the app, which frees up some resources there. And then also we looked at reimbursement pathways and models. So we know that breastfeeding can really help with gut and immune system health for the newborn and also for the mum, which can have a positive benefit on costs later on. So creating reimbursement journeys with breast pumps is really positive. And we also give our members discounts off the Philips products.
And working with Group Mutuel has been really inspiring for us, because this is more than just health. This is about people. And especially at an event like this, when we heard so much about Gen AI, that's all about efficiency and cost cutting. This is about investing in new families. So we help people with going through physical and mental changes. We help people to create this amazing experience with your brand, with brand love in mind and NPS. And at the same time, we also foster a relationship that is focused on the long term. Because we know if you support people through that crucial life moment, when they build their family, they will be thinking about you for a lifetime. Now, we said we were going to talk also about some of the ROI for insurers, and that's actually where it really starts to hit home. Because in the work that we've done with our customers and our clients and partners, we see that people who have experienced the benefit of Pregnancy Plus give their insurers an amazing rating when it comes to satisfaction. They also show that they are way more likely to retain with their insurance over time. So 89% want to retain with their insurance for the next year. And also, we see increases of 56 points in NPS for their insurer by using this type of service. 56 points increase is amazing. 56 points on its own would be amazing. But then it doesn't end there, because with the service, what we care about is about reaching all of these families in that crucial life moment. And it's about engagement, creating millions of positive touch points, helping people to get access to the resources that help them to have a healthy pregnancy. And then that's actually what it comes down to for us, because as Philips, we have a mission. We want to reach the lives of billions over the globe. And a big portion of that is 400 million in underserved communities. And bringing it back to the beginning of our presentation, women's health is part of that underserved community. So that's why we feel deeply connected with this as a mission and as a passion to also improve the lives of women and see that as part of the core work that we do. Now, to close us off, Emily's going to take us through a couple of the key takeaways that we want you to think about as you think about also how you can support your policy members.
Thank you. So to finish up, I hope you've realised from the last 15 minutes that women's health is in fact an important, underserved group that you really should be focusing on and targeting. We know that women are the gateway, and they're definitely ones that are making the decisions when it comes to insurance, so they really are key to target. And hopefully you've seen from some of the results on the last slide that equity really does equal that positive return on investment. So we've seen that we can increase brand satisfaction, loyalty and retention, really key metrics, and improve that NPS score. So you can see that the results have now been proven, the return is there. We should be investing in this space in women's health, but particularly during such a key critical life stage as pregnancy. So thank you so much for listening. We really appreciate your time. Here's some QR codes to scan if you want to connect with myself and Ray on LinkedIn. We'd love to continue the conversation and help you implement a women's health strategy in your organisation. We're also hosting a roundtable tomorrow, 11:30, so I don't think it's too late to join. So if anybody's interested, you can find that information on the app. And we look forward to speaking to you over the next couple of days as well. Thank you so much.
Thank you so much.